thank you so much for being here for National Health Center Week to discuss a little bit more about Hamdard Healthcare and what it means to us. My name is Kelly Albrecht. I'm our Manager of Quality and Risk here at Hamdard Healthcare. I've been here for about 10 months now, and it's been a very rewarding experience. I want to start just going around. Can everyone introduce themselves and just in one or two sentences talk a little bit about what their job title and what program they're in is?
Hey, my name is Marco Diaz. My title is Community Relations Specialist. My position has both internal and external sides of it, in which I oversee our health educator and health navigator. So over at Hamdard, we're very cognizant of not only having the important talk of take your vitamins, take your vaccines, but also being very aware of housing situations of individuals, their diet, all that good stuff is very important to address. So in a nutshell, I'm able to sort of under myself have the health education, health navigators, help people apply for insurance or apply for SNAP. But all that is relating to my now external side of things, where I'm in charge of meeting up other organizations, putting on some sort of tabling event, getting Hamdard's name out. Even simple things such as being at the local apartment complexes or grocery stores, places where individuals may go to more so than the library, places like that we sometimes forget that not everyone has the same sort of approach to life. For example, if you're not visiting the library, you're at least going to the grocery store. So Hamdard being out in the community, letting people know there is an option for health and sort of just give a comprehensive approach to health. So that's what I do. Kelly, I let you pick the next one, all right?
Yeah, Marco, sounds like you keep yourself pretty busy from all of that. All right, Melinda, can you introduce yourself?
Sure. Melinda Correa, practice manager here at Hamdard Healthcare Chicago. I've been in the position for 8 months now. I think I know everyone with the exception of Marco, so nice to officially meet you. I play a pretty transparent role here. I'm also a registered medical assistant, so I can help clinically when needed, where needed. But yeah, just essentially maintaining the day-to-day operations here in the clinic when it comes to scheduling, provider end, MA end, and at the PSR level.
Great, thanks for that. And Dr. Esposito.
Hi, everybody. My name is Dr. Esposito. I have been with Hamdard now almost a year in September, and I am a family medicine physician. And I work primarily in the Addison location. Up until recently in February, I became the medical director for Hamdard, and this has allowed me to be part of the background of just being part of how the organization came to be, learning more about Hamdard, and all the opportunities that we have available here. So that's pretty much what I do, and that's all.
Wonderful. I think I speak for all of us when I say we have a really great group here of different experiences that are going to be really wonderful for this panel, because we have outreach, we have clinic management, we have one-on-one provider relationships with patients. Just to go into our first question here, one of the reasons that I was really attracted to Hamdard, and I think all of us share this feeling, is because we're such a diverse workplace, as well as we serve a large diversity of patients. So being that we pride ourselves on serving all of our diverse community and meeting them where they're at, both linguistically and culturally, can you speak a little bit about what that means to you and the patients that you serve, or the people that you serve?
Well, my degree is a Master of Public Health. My professional career and also my life experiences sort of pushed me into my life here at Hamdard. now, coming as a first generation immigrant family, seeing the discrepancies between what the quote unquote family or cultural approaches to health, and then being and seeing sort of the Western medicine approach to health has really made me sort of very interested in sort of helping bridge the gap between the distrust in a lot of minority or especially I can speak of like Latino populations where you may trust your neighbor more than your doctor. And so I see myself as sort of the bridge of being able to have those tough conversations, important conversations with my community. Obviously I'm a native Spanish speaker, so being able to convey that message and have a familiar face and understanding of cultural norms, I think is really what I'll repeat myself, and that's a combination now of my professional career and my life experiences that really I've found a nice foot in Hamdard, and I'm really excited to just continue having those important conversations, continue connecting our community with resources, because it's not if there's any options for us, it's where do I start? And so I think at Hamdard, we really value and appreciate being able to make sure that it's a full circle, make sure that health and access to resources is something that we're definitely able to offer and that we're going to continue offering. So that's my answer in that sense.
Great, Marco. It's really, I think you touching on the fact that you're able to connect with the community, and because you connect culturally with them, really speaks a lot about what the great work we do here too. Dr. Esposito, kind of on that note, can you talk about what your ability or our Hamdard's approach of cultural and linguistic tailored services has had on the impact that that's had on your patients, or how you've noticed it?
So the ability that we have as clinical providers to speak to our patients in their native languages, either through interpretation services that we offer or through our own personal, we're able to speak their native tongue, I think really, like Marco said, bridges the gap where there now is more of a relational experience with the provider, with the clinical provider and the patient. And I think by having these services that we offer here, we're able to reach more people in the community, being able to speak their native tongue, not only speak their native tongue, but also come from similar cultural backgrounds and empathize with the social issues that they might be affecting them, as well as how is that affecting or impacting their health. So on a personal level, I have worked at other underserved communities in clinics, and I've really been able to see that relationship grow between patient and clinical provider. The patients really trust you. They want to stay with you. They know that really nobody can understand them as much as you can, and really are committed to trying to improve their health because you're also invested. So I think it's really been a very rewarding experience for both myself and the patients that I care for.
Wonderful. Thank you so much for sharing that. Melinda, at Chicago location, we have a variety of different languages that we serve here. Our Addison location, a large majority of the alternative languages we have are Spanish. And Chicago, it looks a little bit different. Can you just talk about how that experience has been? What have you noticed with patients, especially with all of the different languages that we provide here?
Sure. I would say primarily here in Chicago location, our patients consist of Urdu and or Bosnian. So all of our frontline staff regarding PSRs, they all speak Urdu. I do have a few who are trilingual and also speak some Spanish. Maria, the MA, speaks fluent Bosnian, as well as our patient care coordinator. I speak some Spanish, not as fluent as I would like, but definitely it motivated me more to learn the language for sure. I mean, me personally, I've never worked for FQHC, so it took some time to sort of wrap my head around this type of environment versus the big corporate world that I'm used to, or that I was used to back in Denver. But it's really a family here. These patients are so comfortable with the staff, and it's not just like, you know, a regular patient walking in saying, I'm here for an appointment. You know, they're always engaged in conversations with the front desk, with our providers. You know, it's unique. Also, just a wide variety of, you know, things that we do here as far as, you know, our ADS clinic, you know, them giving the weekly packages to those patients who aren't able to come in any longer right now because of pandemic. It's just a lot of great work and super rewarding. It's super meaningful. I think we're all in healthcare for a reason, obviously. But again, somebody who hasn't been really accustomed to this type of healthcare setting, you know, I'm always taken back by the work that we do here.
Great. Melinda, I think you touch on a really important point in celebration of National Community Health Center Week, and then celebrating FQHCs and what community health centers mean to the communities here. Your comparison between us and the corporations you've worked for before, it really goes to show just how much of an impact we have on our local community and the cultures that we communicate with, and how we relate to our patients, where it is more like a family and people can come here and, like Dr. Esposito said, build that relationship and feel safe in the environment with people that understand them. And obviously our staff at both sites are definitely connect with the community in that way. And that's a way that community health centers really do provide high quality care, especially with patients that might be underserved coming from are coming here as refugees, being able to provide them that high quality care that meets them where they're at, linguistically and culturally, with people who can understand, I think is so critical to the work that we do here. So thank you everyone for sharing about that. And Melinda, you kind of predicted some of the future here with some of these questions, but I wanted to just talk about how Hamdard is different in the sense, or how FQHCs are different in that we are connecting our patients not only to Dr. Esposito, not only to providers, but also we're meeting their needs elsewhere. So if a provider is seeing a patient who has an issue with housing or has an issue with food, how we're catching those people and connecting them with their health navigator. Does anyone just want to touch briefly on how these services work together at Hamdard to better serve our patients?
I'll give you a little bit of insight into more clarifying what I sort of alluded to earlier, where I mentioned the importance of a comprehensive approach to health. Now, I'll give my side of these referrals that I see, and then I think Dr. Esposito as a provider can elaborate on how those cases come over to us. So, you know, we're priding ourselves in letting individuals know that getting in contact with resources such as utility bill assistance, or some help with rent, or getting an idea of what resources are out there that allow individuals to continue their path of empowerment. I just value and see our work as very important in that sense. It's just very easy to sort of point fingers and put blame on one specific thing in an individual's life that may have them in a negative situation. But I think that the human being spirit is comprised of different factors, and it's an influence that one little thing leads to the other, and us as health navigators are able to sort of have that conversation of what does your refrigerator look like? Do you have enough meals to last yourself for a week if you weren't able to go to the grocery store? Sort of prodding and picking out those questions into individuals that maybe don't even realize that they are food insecure or they are housing insecure. And so, that stress does weigh on the system. And as a human, I believe that it does dictate health and outcome, and being able to get to the doctor, get out of bed, and really be more proactive with your health. I think that once we give someone a foundation, they're able to be more able to sort of flourish and sort of continue that path of empowerment, which again, I always talk about, just because, at Hamdard, we really want to be the last stop on somebody's path to empowerment, where all questions are answered and they are able to be referred to other partners, other resources in the community that really allow for an individual to sort of just continue on in their way to living a healthier and better life. So that's my take on it. But I think that the provider side of things, really, that's an important thing to sort of talk after I just talked about the other side of after we get a referral.
Yeah. Before Dr. Esposito, I just want to say, yeah, I think that that's an important component that we have on our health navigation side, and check for patients that maybe don't realize the different determinants that are in their lives that are impacting their health. A recent study that came out found that children who were in the bottom 20% tile socioeconomically were 2 times as likely to die before the age of 5 than children who are in the top 20% socioeconomically. So it just goes to show all of those different social determinants, or all of those barriers, can really impact health. Dr. Esposito, I'm definitely interested in hearing your thoughts on this too.
Yes, of course. And you're exactly right. There's so many factors that determine and can impact our health. And socioeconomic is definitely up there. Mental health is up there. And obviously physical health. All of these things are determinants is how we're going to do with the caring of our health. And if I see a patient who I'm going to ignore all those factors, and I'm just going to prescribe medication, and not really knowing if that person can even afford their next meal, my medications is going to be what I prescribe to them is going to be worth nothing, because I'm really not impacting them in any way if I don't address the barriers that they have. And so I think for me, getting to know the whole person in the clinic setting really it's key. Trying to figure out if this person will be able to follow through with medications, or if there is some barrier that we can resolve. And so if they have lack of insurance, then we, as providers at the clinic, we put in referrals to the patient health navigator and are able to then connect that person to the services so that they're able to get empowered and get those services that they need. And the same goes with mental health. If we see that's the first point of contact for the patient, and if we're screening them and they screen positively, then we then move them on to the next arena in our clinic, which is the mental health services. So we're trying to provide for the whole entire patient, and not just specific issues, but really dealing with the patient as a whole and trying to help them better navigate this. And there's so many people that have been so grateful for the services that we've offered that is why they continue to come back to us. And it's not only for what we can provide as clinical providers, but what we can provide as health navigators, and what we can provide, as Melinda said, on that personal level, and really making sure that we find out those answers about how are you doing? How are things at home? Do you have everything that you need? Were you able to buy your medications? If you were, great. If you weren't, why not? So I think that it's really delving in deeper into a personal, relationship with the patient.
I believe that that was a very powerful testament in your outlook as a community health provider that is looking at patients from more than just a medical model, but looking at those. And that's exactly what our patients need that we see here, because so many of them are facing struggles that if we have providers that aren't looking for those things, you're, like you just said, the medication would be useless. So it's a wonderful example of how we are making sure that our patients are well taken care of. Melinda, any comments about, because you kind of oversee the systemic structure of how these referrals are working. You just want to talk a little bit about the team that exists that kind of makes sure that these patients are taken care of on all assets?
Yeah, I mean, I would say between Chicago and Addison, I would say Addison patients come across as more staying connected to like social media, knowing how to access the portal, keep them more in the loop in that aspect. And whereas opposed to Chicago, majority of our patients, aren't social media savvy, aren't savvy with portals. So it's really by word of mouth how we keep our services, promoted within the community. Melva, she's a huge advocate for Chicago. She will literally stand in front of our building, stopping random people, offering services, making sure that patients are good. I've seen her like waving down people across the street. She's such a model for advocating for our patients. And Mubarak, I don't know if you guys have had a chance to see him in action. He's making daily stops at people's houses, delivering fruit, delivering baskets. So it's really important here that, we stay engaged with our community, because like I said, I don't think that, necessarily they're bringing up Facebook or, Instagram, like what's the latest news going on in Hamdard. It's really by word of mouth and by the community. So with the team here, I think that, we do a really good job making sure that, we stay connected. It's obviously hard right now because of pandemic, and I think that there would be more, amazing work, with that, with, getting marketing out and word of, our people out there within the community. So, but we got to be careful. But that's something that I think that we need to continue to brainstorm, how do we keep that going? And make sure that, people are aware of our services and what we do, and that they can come here regardless if they're able to afford, care or not, they can still come here.
Great. Yeah, I think that you touching on that aspect too, and along with what Dr. Esposito and Marco have said, really just goes to, again, show the importance of a community health center. We're not here for profit. We're here and we're waving at people down the street, and we know our patients. We know when they come through the door who they are. We know what they need because we talk to them, and we talk to them like family. And it's just it's a large testament to the importance of us as a federally qualified health center here, because we're not just looking to get numbers in the door. We're looking for relationships, and we're looking to improve the health outcomes of our most vulnerable patients. So thank you very much for all of that. Melinda, you touched a little bit about obviously we're all meeting right now over a Zoom call because of the pandemic. Maybe this is more so for Dr. Esposito and Melinda, but maybe Marco, you'll have something to say. In regards to telehealth, can you talk about our patients' experiences to adapting? Dr. Esposito, of course, I'm curious to hear about how your experience as a provider with these patients over telehealth has been working, how patients are adapting, especially in this stressful time. And then Melinda, I'm really curious to hear about, especially because you mentioned we've been having our patients in Chicago are less tech savvy. I want to hear a little bit more about how we are reaching out to those patients to make sure that we're keeping them safe and having those telehealth visits. Dr. Suzito, do you mind starting?
Definitely, sure. Yeah, telehealth has, it was something that we hadn't heard of. I mean, we had heard of it, but really wasn't widespread. And I'd heard some of my colleagues going into telemedicine, but I was really like, what is that all about? Is that really something that clinical providers can do. How are we really examining patients, physically examining patients over telemedicine? So I really didn't know much about it when I was thrown into it in March. So kind of being from a perspective where I'd never done it before and now having to do it. The transition was obviously pretty quick. We all had to adapt pretty quickly and change with moving times, and so did patients. There was definitely a big disconnect with that relationship that we were able to provide face-to-face versus over telehealth. Most of our patients, we didn't really have the visual telehealth. We had mainly phone only. So it's really just speaking over the phone and trying to get the nuances of what's going on with the patient by how they're speaking, or, definitely it allowed me to have more conversations that were more in depth than in person, because people tend to talk more on the phone and just tend to relate a little bit more. But it definitely took away from that face-to-face interactions that we really genuinely also need. So then, we're not able to do any physical exam. We're not really able to do that part of the visit. So that's, a problem I view as a family physician, where I really need to physically examine everybody I see and to be able to, diagnose them. But so, getting to know patients on a more personal level via telemedicine too, getting to know who else lives in the home, hearing the dog bark, knowing that, hey, I also have a dog that barks and interrupts my calls too, and children too. I think it was a really a view into somebody's life, more so than we've been able to do here in the clinic. We just kind of see the patient in the clinic and we really don't know about their home. So just that opportunity to see them in their natural habitat, if you want to say that. But it was a new experience. It wasn't always easy, but I think in the world that we live in now, it's something that's probably going to stay a long time.
Yeah, I think that that's really interesting, a perspective that I didn't think about, with being able to connect more with your patients over the phone, because you are more conversational and it's less, maybe less white coat syndrome, less nerve-wracking if you're just talking to your doctor on the phone. You can't give me an injection if I'm all the way over here. And I also think that there's nothing more humanizing, to your point, than hearing a dog barking while you're talking to somebody. Because sometimes when we're all in our jobs and we're all being very professional, there is that level of just a barrier. But when you hear someone's dog bark on the phone, you're like, oh, no worries, I have a dog too. And it just it allows you to connect in a way that you wouldn't be able to otherwise in the office, where maybe patients are a little bit more anxious. So in regards to that, Melinda, do you want to talk a little bit more about this with our patients in Chicago?
Sure. Just sort of piggyback what Dr. E said. Telehealth wasn't, it was a thing, but I mean, everybody was just used to just coming to see your provider, right? So it was real shaky initially. And I think that, we got hit with this so hard that, everybody was kind of left stumped, like, how do we do this? How do we manage these types of patients? For Chicago, I will say for primary care, it was difficult for both Dr. Alam and Dr. Akil. But, they did really well with connecting with the patients, on the phone. However, they haven't had any opportunity to do, any video capability. And a lot of patients were concerned because when you say telehealth, they're like, I don't have access to, a smartphone that has, FaceTime or, how to access a computer like we're on right now. But really just making sure that, the patient, that we stress to the patients, that's not necessary at the moment, but the provider, would connect with them over the phone. But again, as a doctor, I'm sure Dr. Esposito, Dr. Alam, and Akil feel that there's barriers because, they're unable to assess. And again, speaking to the patient, they're obviously not, clinical. So a lot of things that, the doctors are needing to know. Yeah, there's some barriers there for sure. I think that patients do like telehealth a lot more. We are seeing a lot of patients that would prefer telehealth versus coming into the clinic. I think my hat goes off to our psych team because, they're all pretty much doing the most telehealth visits with video capability. Dr. Fayaz, she was eager to learn, like, how do I get this video on my phone, on my computer, Dr. Kaja. So I would say that team for sure has definitely made some strides in making sure that, they're able to connect. Obviously so, because it being behavioral health, it's a little bit more sensitive topics when it comes to those patients. But I think we've all done tremendous work with telehealth medicine, and I do see it sticking around for sure.
Great. And we don't have a behavioral health provider on the call with us today, but to speak to their experiences off of the conversations that I've had, and correct me if there's anything that I'm missing, but it sounds like our behavioral health patients are really appreciating telehealth visits because behavioral health in itself as well is more of a talking activity if you're doing counseling. It is something that easily transfers to a phone, although some patients do appreciate one-on-one in-person visits. But telehealth kind of does provide you that, just like you were talking about, Dr. Esposito, with it kind of takes a wall down because you're just on the phone and it's less pressure. A lot of patients are really enjoying the telehealth aspect and want to stick around on it. So I'm curious to see where we go as community health centers with telehealth into the future. I'm talking a little bit more about telehealth or just the coronavirus pandemic in general, and then wanting to hear your thoughts about, especially Marco, because we're trying to connect patients to all of these different outside resources, and things have been kind of closed, or hours are different, or no one's in the office to answer the phone. What challenges and rewarding patient experiences, or just anything that you've experienced yourself as well, have you encountered during this time? Curious to hear challenges, but also really curious to hear rewarding experiences as well.
Sure. I'm going to start and sort of talk about a lot of the points Melinda brought up, in which, being able to offer and continue our health education, health navigation services in a world where face-to-face filling out an application is not possible, it really became a case-by-case basis where we'd have to have those simple conversations over the phone, like, hey, do you have an Apple device to do FaceTime? Oh, if you don't have that, do you have a laptop or desktop with a webcam, or just simply a phone call? So I think that with this pandemic, with sort of our situation of social distancing, we really did have to figure it out on the spot. And I think we all did an awesome job of understanding that we were all kind of in the same boat, all figuring it out together. There's no necessarily a clear-cut version of what exactly needs to be done or how it should be done. So we really appreciated our patients, our providers, even our community partners, just really finding out what is open.
I think, again, you continue, all of these answers are continuing to emphasize the importance of Hamdard Healthcare as a community health center. We have these connections with these local agencies. We know our neighbors, essentially. So when push came to shove in this pandemic, and we were all drowning in a large ocean, right? So being able to come together and kind of work on the spot, really continue to forge those community partnerships so that we can keep our patients connected, especially now when times are as tough as they can be for some people with job loss, health, emotional, like you said. I think that's so critical. Melinda, any comments on challenges and rewarding patients' experiences?
I'm sorry, Kelly, like like patients or staff?
I think you can kind of talk. We wrote patients, but I think from your perspective, you can talk about either.
I mean, I always got to throw Maria in the mix. So Maria is our sole MA here for Chicago. She's amazing. I mean, she really pushed to give permission to actually go to a patient's house to collect a urine specimen. This was a 85-year-old woman who lives essentially very close, but doesn't have a car. Her son lived outside of Chicago, so wasn't able to, make it here. She was having some symptoms of, possible UTI. And she came to me, was like, could I go and get a urine specimen from her? And I was like stunned, because I was like, are you really asking me this? So she was serious. She was not laughing. It wasn't really a request. It's like, I want to go. So I talked it over with, Sean, and, we agreed that she could go, but she was to don full PPE, just get the specimen and, leave, which she did on her way into work the following morning. And the patient did end up having a UTI, which Dr. Kill was able to prescribe antibiotics. And the patient was just so appreciative. She was in so much pain, so much discomfort. And I really just, want to say that goes to show that, we have this MA who's, willing to do whatever it takes to make sure that we take care of the patient. Well, I think that, that was priority. Her safety was obviously second, but just making sure that, as a manager, I made sure she was safe. There's still that risk, but it's like she didn't even care. She wasn't worried about that. So, we've had our frontline staff from the beginning when all this took place in March. And I just think that, we're accustomed now to coming to work every day. But I think our patients are just, generally happy that we're still open, that, they can still come to the office. Obviously there's so many changes with donning masks, making sure we're 6 feet apart, making sure we follow the protocol, because we do have those, walk-ins who, often present with, possible COVID symptoms. So we've had our share of scares. But I think it comes down to patient care. And I think that, our patients are very appreciative of us always being available.
Wow, I didn't know that story, but that's extremely touching. It doesn't surprise me that our Maria, the MA, would choose to do that. But that really just, again, is just going to speak to how connected we are with our community and how much it means to us here. Dr. Esposito.
Yeah, of course. We have had many, I think, rewarding experiences during this pandemic. I think the way we have come together as an organization really to provide the services that our community needs has just been great. I mean, everybody has come together. We're all in this together. And, we've been providing COVID testing in Addison for the past, since it started really, this pandemic, and really everybody's jumped in and has put their fair share of work in to try to provide as many testing, opportunities for patients.
So we have just a couple of minutes left. So I saved this question for last because I think it's pretty important. But if you can give it to me the answer as shortly as you think you can. What do you think makes Hamdard Healthcare so special, or why is it special to you?
I would say my team. I think that my team. I've heard what previous stories what leadership was in terms of managers, and I think that I've made some strides to get these girls to open up a little bit more, and I feel like I've given their voices, and it's comforting in knowing that they trust me enough to voice some of their concerns. And I say this because they all come across as wanting to be here, wanting to stay here, wanting to then they're all young. So I know that they want to make careers of Hamdard and, want to be part of this team for a very, very, very long time. But again, also wanting to see changes, much needed changes. And I think that, they've seen a lot of that happening just in recent months. Sean Burke has done tremendous work with this team. Dr. Esposito, you're amazing when it comes to, getting providers on board. I think that we really have a hard team in place to make these changes.
Melinda, I think you nailed it right on the head. I think I agree with you. What makes Hamdard special is who I work with, who the team I'm part of, seeing everybody working together and making the switch to work from home, to get things solved where we didn't know how to do it necessarily, but what we did have was sort of that drive to figure it out together. So that's what makes Hamdard great. I think that if one individual or one team can't do it, we can count on somebody else to jump in, and we sort of all play nice in the sandbox together. So that's my quick answer to that.
Yeah, definitely. We are all team players. I think we've all really kind of come together during this pandemic to serve the greater good, and really have put our best foot forward. Working in an FQHC is like Melissa said, it's definitely not corporate. We definitely are more family, and we care about each other, and we notice when somebody's missing or somebody is not in at work. And I think we're all looking out for each other as an organization, and we really are invested in the people we serve.
Great. And I don't think I can ask that question without answering it myself as well. What makes Hamdard so special to me is that we are a place of people who care so genuinely about the patients that we serve. And we provide and we are able to give an experience to a patient who might have had worse experiences at other places. If they're uninsured, not being able to have a place to go to. Being able to provide that place and not only have a place, but also a place that provides that high quality, safe patient care, I think is so critical to us. And that's so special to me that you can come in, apply for a sliding scale fee. Oh my goodness. Gonna have to edit that one. And you can see a doctor and get that high quality experience. That in this nation where healthcare is so highly sought, but you're not always able to get it because it's very expensive. I think that's just so important. Well, I think that concludes our panel. Thank you so much. I learned a lot from your perspectives, and I think that you all really spoke your own truths about Hamdard Healthcare, about how we as a community health center really impact our patients, and about how much we care about each other and our patients and our teams. So thank you so much again for joining us today. I hope you have a great day.